Okay, well, welcome back to 10th Man. Today I have a very special, esteemed guest who has reached out to me from across the globe. Uh, Davide de Salvio, I'm saying that correctly?
De Salvia,
Salvia, sorry. Okay.
no
And you are
problem.
from the University of Milano Bicocca. Am I saying that right?
Yes,
Okay.
yes, that's correct.
All right. Um, so you reached out to me a little while ago about the situation going on with the pandemic. And I understand you have some things you'd like to share. Um,
Yeah,
so would you be able to just kind of give me a quick background on your area of expertise, your area of study,
yeah, sure.
and kind of what brought you here today?
Yeah, I am an international medical student. I am an IMS student. I study medicine and surgery at the University of Milano Bicocca. I am also I am one of the chief executive for Young Doctors for Italy, which is an organization in Italy that helps the parliament in writing the law with other organizations like us. We do cabinet level meetings. We basically take care of the healthcare, and we also help our legislators to give more an inside look to the world of healthcare, because sometimes the world of healthcare can be very confusing, can be very, I want to say, secluded sometimes, very secluded, because people usually don't understand and don't know. They only go to the hospital and see the people with the white coat, but they don't know how much there is behind it. They don't know, for example, what is the logistic of healthcare, what means logistic in healthcare,
Mhm.
what is all of this, what are the people behind the white coat. So this is really important to understand, because right now, in these trying times, in these hard times, yeah, every single healthcare system in the world is put under strain, under pressure, and no country on earth was prepared to deal with a global pandemic. No one is, because no one expects it. No one never expected it. You can have a lot of contingency plan, you can have a lot of fallback lines, but in the end, sometimes things just don't work, because sometimes the pathogen is different, sometimes the means of transmission are different, sometimes you simply have some bureaucracy and some human issues that maybe let you detect the virus too late. I
Right.
will say it. I will say it simply, just a fact. Here in Italy, we have discovered, thanks to our water analysis, that we had traces of coronavirus, of COVID-19, back December, in December of 2019. So the virus was circulating in Italy already from from December of 2019.
Hmm.
So this means that when we detected the virus in February in Italy, actually it was already circulating freely for over 2 months. It will be the same. It is likely to speak. It is usually it will be the same also in the US. Then when you detect the virus, your first case, actually maybe your real first case could have been there from maybe 1 month, 2 months
Right.
earlier.
Right.
When you look at each number on a chart, when you look at every number, you need to understand that the number is an estimate. It is nothing. It is nothing set in stone, because right now, no one on earth knows exactly how many cases there are in a country, when it started, and how it
Right.
started in that country. Maybe we know the virus because the virus is probably and likely a zoonosis. Zoonoses are not new, because I've seen a lot of conspiracy theories around, it is created in a lab and everything like that and everything like this. Guys, no, it is simply a zoonosis. Zoonoses have existed since the birth of time. Zoonoses are the diseases that pass from a species to another. That's
I
it.
see.
It is nothing magical. It is nothing strange. For example, the Black Plague. The Black Plague, the Black Death was a zoonosis.
Hmm.
Right. Back in the days, they didn't have
Right.
genetic labs. They didn't
Right.
have any kind of labs.
Right.
So, because when you start looking into it, it is really simple, because sometimes the cells that constitute different bodies are more similar than maybe we can think. So sometimes the receptors, in this case, the the ACE2 receptor, which is the receptor that is present into the ciliate cells of the lungs, of the respiratory tract, and also into some cells of the gastrointestinal tract. But I don't want to bore you with details. The point is that this receptor, which is the key to enter in the cell, which is the key that COVID, this virus, this SARS-2 novel coronavirus, exploit to enter in the cell through a process called endocytosis, because it literally, it is, as the word says, it literally clot himself into the membrane of the cell and literally projects himself into the cell, and then it replicates. Because guys, a virus is not a living being. A virus is not a living organism. A virus is a parasite. The virus need other cells to replicate, survive, and prosper. Otherwise, they simply die.
Right.
So this virus hijacks and exploits our cell. This is what he does. He enters through this receptor called ACE2 receptor, because I think everyone is familiar with the shape of the virus. That little spikes that we see are the keys that he uses to open up the cell and then enter into it, and then replicate, put his genetic material, etc., etc., etc.
Right.
This is it. Also, just another funny fact: when you see the damage that the virus does, you understand that it's actually really, really dangerous. Sure, it is not the most dangerous disease on earth. There is always something terrible. But the problem, the big problem with this disease is the numbers that we're talking about. Because when you have a disease with a lethality, for example, of 90%, yeah, sure, it is more dangerous per se than COVID. But how many people can disease infect? And how many people can COVID infect? Because if you're talking about a mortality rate, for example, for children, is 4% the mortality rate. If you talk for children of age group between 0 to 12, this is an average that I did. I can show you also later the studies. With this mortality rate that you have of 4%, if you talk about, for example, in America, let's say that you infect 80,000 children, 4% of 80,000 is 4,000. 83, the correct number is that today, 4% is the critical condition, not the death rate. It is the critical condition of the child. Sorry, guys.
Oh, okay.
The 4% of the children go into critical conditions. So the problem is that critical condition today, we don't know exactly how they will recover, if they will recover,
right,
and when, because the virus is new. So the long last damages of this virus, we don't know them. We don't know nothing, because what it will happen in 1 year? The lungs of this person that got infected, will they recover fully? It will be able to live a normal life like before? We don't know it. The number of children today that got into critical condition is 400, 1,051. But if you see only the percentage, is 4%. But the actual number of people is this. How many people died in the Twin Tower attacks? Around 2,000. For 2,000 people dead, USA declared a war.
Right.
It went a war for over 20 years. And then for 4,000 kids that maybe will not be able to run, maybe will not be able to recover. Guys, this is the problem, because sometimes when you see an explosion, when you see a big problem, something very flashy, it usually generates an emotional response, okay? But sometimes the worst things are things that you don't see. Sometimes the lives are taken not with a flashy explosion, but they're just taken away by a disease.
Right.
And the deaths are all equal. You showed in the USA a lot of resolve in fighting, the terrorists. Maybe maybe there is some political connotation that someone can say has been a good thing, a bad thing. I don't want to enter into politics, but the point is that you showed resolve. You showed a lot of resolve. What is your resolve right now that you are arguing over face masks? It is crazy.
Yeah.
It is simply mind-blowing. people 1 century ago, literally more than 1 century ago, during the Spanish flu, during l'influenza spagnola, during the Spanish influenza, they understood that they needed to wear a mask, because if something is transmitted through air, it will, you need something to block it.
Right.
It is not rocket science. If I can breathe and get you infected, I need to put a barrier between you and me.
Right. And isn't that, and thank you for everything you just said, because you've laid it out in a way that I couldn't hope to do. And so from what I'm understanding, and you were talking about that it's a parasite, so it needs a living host, right? So
it is not exactly a parasite, because parasites are different means, but it acts like the parasite. So we can say it has a parasitic like attack
right.
and life, because parasites are different things. Parasites are composed by cells, but it works as a parasite basically, and on cellular level.
So when it comes to like the masks, like you were just talking about, is that why they are so effective if they're used constantly across the board? Because we've in places in our country, and obviously in Italy and other places where they're much more consistently enacting social distancing and mask wearing, the cases are getting massively under control. And from what I'm understanding, that's because those not parasites, but like parasites, as you said, are not having the ability to latch on to a living host. Is that correct?
Yes, totally. Also, guys, we also need to understand that right now we are facing COVID into its worst season. It is like fighting an enemy, because it is literally an enemy of ourselves, so of ourselves, in its weakened state. It is like fire. It is like when it is like invading Russia in winter. It is the same thing. Simply, the environment will kill you. The environment will stop you. The environment will hinder you. The same stuff here. This virus is hindered by heat. There are studies that have shown that the virus is temperature sensitive. So, for example, at 56 degrees Celsius, don't ask me to do in Fahrenheit, you can do the math, it die. The science uses
and Americans, we don't know Celsius, so I'd have to go back and look at the charts to do the math.
At 56 degrees, it is not a temperature that you will usually encounter, because it is very hot. The water boils at 100 degrees. 56 degrees is basically midpoint. And 56 degrees, the virus lasts for 15 minutes. At 4 degrees Celsius, which is a normal temperature in winter, it is the normal temperature that we'll encounter into not really cold countries. It is not hot, but it is not snowing, because the snow falls at 0 degrees Celsius. So it is a little bit higher than snow temperature. The virus doesn't die from a temperature point of view. Wow. So imagine that when we will get in winter, maybe that bus handle that you touch a few hours ago had some COVID in it. If you were into summer, the heat would already have killed it. But right now, the virus is still present. So you will get infected. Because maybe afterwards, you will put your fingers up in your nose, you will scratch your eyes. So this is the point. This is the point. In the winter, it is feasible to say, and it will likely happen, that the infection rate will start again, and it will, well, for us start again, for you it will increase, because the virus, it will spread more easily. The environment will not hinder it anymore. It will, guys, it could be a massacre, really, because the environment is playing a really, really, really big part in it. We still don't know exactly how much, but it is feasible to say that it's playing a very big role into hindering like right now. Sure, it is not playing a major role, because the most important thing that you can do is socially distance. It is wear a mask and not get infected in that way, but for sure is helping.
Right.
It is not winning the war, but is helping winning it. So
keeping it under control. Yeah.
Yes. So when this helpful factor will go away, it will be bad. Very, very bad.
Yeah. Also, go ahead.
Also, there is one thing that I really want to stress, guys. Masks are not an option, and there are different levels of masks. Can I show them?
Yeah, definitely. Please.
Yeah. This is an FFP1 level mask. The mask that you normally wear, it is a surgical mask that we use during surgical operation, that are used right now all around the globe. These masks doesn't stop you from getting infected. These masks only protects others from you.
Right.
It will not stop the virus into entering into your own body, because it is not exactly sealed very well. It doesn't have the same it doesn't have the same tissue as an N95 mask, which is an FFP2 level mask. So there are differences that they will stop you from infecting others. But if a person next to you, for example, on the bus, on the train, on the beach, on the shop, on the streetway, doesn't wear a mask, and he has COVID, which could be an asymptomatic carrier, a super spreader asymptomatic, which is the most dangerous type, he could easily get you infected, because you think that you are safe, so you take more risks, because it is shown that people, when they feel safe, when they feel safe, they take more risks. So you don't socially distance, because there is this little bit of mental breakdown that sometimes one person thinks, yeah, I'm wearing the mask, so I am safe. No, you're not. No, you're not. No, you're not.
Yeah, no, I could see that.
Because
I'm probably guilty of that myself. I mean, I feel like when wearing my mask, I'm kind of, protected. It's like my safety blanket. But I wanted to ask you, because that's how I've understood it too. I've understood that when you're wearing a mask, you're doing it as a protection to other people. So you're practicing compassion and empathy. You could argue. Why is it that the virus is able to stay contained? If you're wearing a mask, you're protecting other people. Why does your mask not protect you from the outside, the virus coming in? Because that's one of the things that people will say, well, if it works one way, why doesn't it work the other? And then they use that as justification to not wear it at all.
No,
right?
It is not at all that difficult to understand when you start seeing the details a bit. The virus spreads thanks, for example, to our propulsion from our own body. So you cough, you sneeze, you breathe. If you put that kind of mask on your face on FFP1 level, you will actually stop the particles from coming out and reaching a big distance. You will not stop them all, so you will not. So you will stop a good percentage of it. So for this reason, the viral shedding, which is the amount of particles that are dispersed into air, they are not enough to infect a person, because literally you still need to have a determinate percentage, a determinate number of virus particles to infect someone, because it is not like that you literally get one virus into your body and you get infected. No, of course, you need a certain concentration of it. So the masks prevents from reaching that concentration level to infect another human being. But the mask is not strong enough to protect you from getting the disease from the outside, for the same principle.
Right.
Because the mask, let's see what happens when I wear it. These masks, the air passes through here. So from the outside, from the environment, the air enters through here. Right. But when I cough, the air gets stopped here, gets stopped at this level. So it doesn't go, you don't spread it around. But you are not protected from the outside, because the virus can enter from here, can enter to your eyes, into the mucus of your eyes.
So in layman's terms, just make sure I'm understanding. And so because I try to make sure I'm educating people, we talked offline, like I'm not trying to say that I'm smarter than anybody else. I'm just trying to listen to people that are smart and do my research and make sure that I'm, so I'm not arguing, but I want to make sure that I can explain it to other people.
Sure. I can explain it 10 times. I can change vocabulary. Sure, no problem.
Well, I just want to make sure. So I'm understanding is basically in a nutshell what it is that your projectile, in a sense, when you're breathing, is gonna allow a higher concentration of the virus to jump out there, whereas when you are wearing the mask, you're basically containing it in that area. You're still breathing out. And like you said, some particles of the virus will still get out, but it's going to be in a concentration that's not enough to infect. And then when you're
Totally,
wearing the mask,
totally,
it's not able to stop the other person who is projecting their virus. That's basically what
totally,
you're saying, right? Okay.
totally. Also, there is, I will simply show the difference with an FFP2 level mask. This
Okay,
mask
great.
protects you from getting infected.
So this is
Remember,
what, yeah.
sorry for the noise. Sorry for the
Okay.
noise.
So this is like what hospital workers are wearing, basically, right?
Yes, this
Right
is the
now.
N95. Yeah.
Okay.
When you put this,
Yeah, glasses are the worst with these masks, right?
yeah. When you put this, you see that right here there is not space. There is no space.
Right.
So the virus cannot enter because there is a seal around me.
Right.
I am sealed from the outside world. I can breathe, of course. I can
Right.
also. Sorry, I will take a little divergence, guys.
No. I was gonna.
Masks.
I think I'm good. I was gonna ask you about what you're probably going to say, so that's good.
Yeah, guys. Masks don't let you rebreathe your own carbon dioxide, because I have heard in some videos that people say carbon monoxide. Guys, if our body produce carbon monoxide, we would already all be dead, because carbon monoxide has an higher affinity level to hemoglobin, so you die. Okay? So
Right.
it is carbon dioxide, CO2, not CO for once. And for
Right.
second, this is an saturimeter. These little instruments help us to measure our partial pressure of oxygen in our body. When I turn this on, it will be around 98, 99, which is the normal value. I have my mask right now. It is turning on. I need to put my finger right. I need to put my finger.
It's like a digital thermometer for your hand.
Yeah.
All right. Okay. Fingertip.
Yeah, and I'm waiting that is making its readings.
So the not normal reading should be about 98, right? Or is that
98, 97, 90, 98, 96, major than 95, it's good, basically.
okay?
98,
Is that
as you see, is
98?
90. Yeah, sorry, guys, but...
And you're wearing the sealed mask that's actually
exactly.
more sealed than the normal like
Exactly.
respirator mask that we were talking about before.
99. No, so okay. You have seen it. It is 99. So I'm wearing these masks and I'm getting oxygen fine without any problem. So I am not getting any kind of problem with a mask. The mask will not kill you, will not harm you. A mask, the only thing a mask that can give is saving a life, and maybe from a psychological standpoint, but this is still a matter of research, you could feel that you're getting less air.
Mm-hmm.
Okay? But in actuality, with the data, with the instrument that literally measures the amount of oxygen in your body, you have the same.
Right.
So,
I'd have to imagine that in all these years of people working in the medical field, they've been wearing these masks for a very, very long time. If there was some kind of health risk to your breathing, wouldn't the medical community have noticed that by now and addressed it and maybe made some changes?
Yes, of course. We normally use the surgeon uses the surgical mask maybe for 8 hours, 9 hours, 12 hours. It depends from the operation when they stand still operating a patient. If these masks that people are required at least to wear would be harmful, all the surgeons in the world, they would all be dead.
Right.
You would have no more surgeons because they wear them every day.
Right. I think that points to one of the common themes that I see here, unfortunately, in the United States, is that if it doesn't affect you directly, then you don't notice it. So if somebody's not been wearing a mask all their lives, and all of a sudden they're wearing one, and like you said, they feel that psychological feeling that they're not getting enough air, they don't seem to think or consider the fact that the medical community has been doing this for a very, very long time. And they're telling you that it's okay, like you said, we'd all be dead if that were the case, but people don't care to listen to that because it doesn't fit into their convenience of having to wear one.
Yeah, the point is that it really fits them, because when you start, it should really fit them, because when you start looking at damages that COVID does, you have different type of damages. You have damages from an operational standpoint and damages from a strategic standpoint. The damage from an operational standpoint are the direct damages that are done to a person. So, for example, a person gets COVID, so he became ill, and he could die. It could get very bad, or he could have a mild case of COVID. So that's an operational field of view. But there is a strategic field of view. When you have a COVID surge in a country, in a place, in a county, for example, when a hospital goes into a COVID surge, what happens is that hospital becomes all around COVID, because you start having such a big number of cases that you need to take care of them. Otherwise, they will still spread. So, and they will infect more people, and you will have bigger cases. So, for example, you will reduce your operating theaters. You will have less surgical rooms. So maybe there is a car accident, let's just say, and then maybe 10 people gets involved. Okay, but your hospital has only 3 operating surgical theaters, because usually maybe 12 are reduced only to 3 active, because 9 are used to put COVID patients, because the hospital will run out of space into put COVID patients. So you will not only put them into your respiratory units, into your emergency department, into your gastroenterology, you will put them whenever you have space. Because when you are getting overrun, what getting overrun means is this: you are literally putting up people in spaces in which you would not normally put them. So you will find COVID patients into gastroenterology, for example. It's normal because the hospital is getting overrun. This is what it means practically, okay?
Right.
So you have less spaces, you have less surgery rooms, and some people die for this reason. It is happening. We don't know how many of them. We don't know the indirect damages of COVID.
Right.
We don't know it.
I think that's such a good point that you brought up too, because you mentioned the other day when we were talking offline about that the death number is actually less than we might think, and you had brought up that you called it indirect death, and one of the things I talk about on the show a lot is this confirmation bias, this idea that you take in the information that fits with your narrative or your convenience, your opinion maybe that, oh, this is a hoax, it's not really that dangerous. And a lot of the cases that are being claimed to be death by COVID, they're saying, oh, well, it's actually because they were really just old and they had some other underlying issue, but they're calling it COVID, where really it's almost the opposite, where it's somebody is not dying because they have COVID, but they're dying because they are not able to get the treatment they need because someone else is they're being overrun with other COVID patients. Is that
yes.
right?
It's totally, because at one you have a limited amount of resources, you have a limited amount of doctors, you have a limited amount of spaces. So if you use that resources to take care of COVID, you're not using them to take care of other diseases. Okay.
Right. Yeah.
And some of these diseases are immediately life-threatening. Some of them, like maybe plastic surgery, are not life-threatening, but some of them are life-threatening.
Right.
So if you're using the same amount of resources and you're using it because the surge happened so quickly and no one was ready for it, and so you don't have time to increase the requirement level of resources to have the same standard of care as before, you are literally losing patients, and you don't know how many of them, because you have a limited amount of space.
Right. Yeah. Don't necessarily have a metric for that.
Yeah, and when people say that the numbers are inflated, guys, they're not inflated. The numbers are, and they're likely. It is not sure, of course, because we don't have any studies on it, any full study on it. But it is probably infeasible to say and think that the numbers are underestimated, not upestimated, because no one in the world knows how many COVID patients there are in this country, how many dead there are for COVID in their country, how many people have died from indirect damages from COVID in their country. No one knows.
Right. Well, and one of the things that we talked about also before was the dangers inherent in people who are asymptomatic, and part of
Yes.
that being like what you just said, we don't know, it might lead to underreporting, because the thing that you said before, and correct me if I'm wrong, but I think what you were saying is that you can be asymptomatic, but that doesn't mean that you're not sick and that you might still
Yes.
succumb to it. And the other thing is, like you said, there is this unknown factor because this is a novel virus. We don't know what might happen to you in a year. You might be showing no symptoms and not even know that you have it today, but in a year, what might happen to your lungs, right? So that is part
Yeah,
of the danger
yeah, of
inherent as
course,
well.
of course, of course. There are some diseases. There are some diseases that get an active manifestation after 10 years, after 5 years, after 1
Wow.
year. Right now, we don't know what it will happen to these people.
Mm-hmm.
We hope that nothing it will happen, and we pray, if we are religious, that nothing bad will happen, that
Right.
is all going to be okay. But we don't know it. This is the point. Also, there are a lot of studies that are showing that asymptomatic people actually get damages from COVID. Okay. So remember, guys, if you don't show any symptom, it's not good usually during a disease, because the symptoms are usually your body is fighting back. When you get the fever, for example, it's because your body is trying to kill a pathogen by raising the temperature
Right.
in your body.
Interesting.
Okay. It is a defense mechanism. So if you're not showing any defense mechanism, it is a problem. With COVID, it is a bit particular because a lot of damages of COVID are done by a thing called cytokine storm. So there is an overreaction of the body, but still overreaction is bad, and not reacting to it is also bad, probably. Okay. We still don't have a clear answer to this. And no
Right.
one can safely say with any shadow of a doubt that, yeah, symptomatic patients is fine.
Yeah.
Yeah, you know this.
I think,
Also, children are fine. Children
right.
don't get infected. Children don't get it, and they are fine. How do you know this?
Right.
Yeah, sure. Right now, yeah, sure. Right now, they are not showing any kind of symptoms or any kind of bad repercussion, and we hope that it stays like this. But we have any proof of it? Not yet.
Yeah.
Not yet.
Right.
This is the point. So for this reason, in medicine, there is a motto: it's better to prevent than cure. It is always better to prevent something than cure it.
Right.
That's the key way of
Absolutely.
thinking in medicine.
Mm-hmm.
There is a thing that
And to overshoot rather than to undershoot, right? To
yes.
plan for
Well,
more.
no. Yeah. On a strategic level, yes. There is a thing that one doctor said in Italy that I totally agree with him. He said, when you're fighting COVID into the hospital, it means that you're already losing. It means that you are already losing. COVID needs to be fought on the streets before people get to the hospital.
Mm-hmm.
Because when people that get really, really serious with COVID are around 20%. So you can mathematically at least add that there is another 20% that are shown into the cases of the tracing system, and there is another 20 up to 40% of people that are asymptomatic. So your number of odd million that you have, you need to up it of 40%, up to 20 to 40%. This is your real number.
Mm-hmm.
This is why I'm telling you that numbers are just numbers. You
Right.
need to know how to look at them. You need to understand what there is beyond a number.
Right.
Okay.
Right. Definitely. Yeah.
Because a simple number doesn't tell the full story.
Mm-hmm.
Also, when people start comparing countries, it is simply stupid. Because comparing countries, it is like comparing different languages. It doesn't make any sense if it
Mm-hmm.
is done without any statistical, real, correction
Context
error,
or
context and correction error. Because, for example, you can compare the numbers in Italy and the numbers of US from for 100,000 population. At first look, it might seem like a correct comparison. Okay, we are taking 100,000 people in Italy and 100,000 people in the US, so it's fine. No, it is not fine because the US, it is a continent. Italy is a small country, small relatively speaking, 60 million people. It
right.
is, you should compare Italy to Florida because you have the same amount of population, oddly enough, etc., 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 you have a lot of environmental and country-specific factors that are at least a bit comparable. You should compare the European Union to the US. And also, in this account, you should also count the difference of population, because in the
Right.
US, you have 330 million people. In the European Union, you have 430 million, 440 million, 444 million. Also, just to tell you, one thing that people don't think of it, it is the number of people per kilometer square, the density of population. In the US, because it is a big country with less people than Europe, it is 36 people for kilometer square population density. In Europe, it is 103.
Wow.
It is 3 times more. So when you're comparing in a global pandemic with this kind of spreading, two countries with such a different population density, it means that in Europe we are more closely packed together. And it doesn't require rocket science to understand that if you're more closer, if you're near someone else, it is easier to get infected. Okay.
Right. But we make.
Also, the age factor. Italy is the second oldest population in the world, and in general, in Europe, because we have universal healthcare. I don't know on the US you call it. We have healthcare provided by the government. People usually live longer,
right?
Because they can afford healthcare and don't die on the street. So,
right.
This is an essential point. When you compare numbers, you cannot only look to the simple number. Okay. In the US right now, guys, you are doing very, very badly. And you are doing badly, I will tell you again, in the worst season of COVID, in which he is weaker, in which the disease is weaker.
Right. If there was any time of the year that we would have to basically make it die off, it would be now, because its lifetime is, its amount of time that it can live without a host is longer, right? I was going to say also it's very interesting that from a natural standpoint or a societal standpoint, you guys in Italy have the odds stacked against you because of what you said, like the population density is so much bigger, and a larger population compared to like the population density here. Or you were talking about the European Union in general.
The European Union in Italy is worse. Don't worry. In Italy is worse than the European Union. We have a higher population density than the median of the European Union.
But yet you're doing so much better than us, because while you guys have the disadvantage in population density, you have the advantage in thinking people who are trying to do the best they can to do the social distancing and wearing the mask. And as you said,
we try.
You also have the universal health care, which I wasn't going to get into too much, because I know you didn't want to get too political either, but that is something that I'm pretty passionate about. It comes up in other episodes at times about universal health care, and how if we had, for example, when this virus first came out, had we had a system of universal health care, I think we would have been able to tackle the virus early on, for one part, simply because people would not be afraid to come in and get treated. Because I think a lot of people, before the CARES Act kicked in and people knew they would be protected, they would be covered if they had COVID symptoms, I think there were a lot of people that didn't come in to get treated because they knew they wouldn't be able to afford emergency care. And because we don't have universal health care, healthcare is a for-profit industry here in my country, unfortunately. That's to me, I feel like that's so archaic, and most other countries, I think that's a pretty standard thing, right? To have universally run healthcare.
It is like paying for the police or for the army. It is something that should be protected. The police, in theory, I say in theory, should protect you when there is a criminal, when there is something bad that happens to you. The same is with healthcare. You don't know when you will get a disease.
Right.
You don't know if you will ever develop cancer.
Right.
Why you should worry about it? You pay your taxes to your government.
Right.
It is not like it is your fault.
Right.
It is it is literally a human right.
Yeah.
It is a human right to be protected. It is a human right to be protected. It is a human right also to have your back covered, because you live in a first world country, you live in a rich country, in a country that can afford it.
Right. And you know, we touched on it earlier. I think there's some parallels here with the American obsession with defense spending. You know, we put so much money into that. And you know, to your point, actually, I know, and I was going to bring up 9/11 too. So, and I'm glad that you brought that up, because, you know, you brought up in the context of the response that we had as a nation. And again, and I did not agree with a lot of what that response was, for reasons like relating to going after Iraq, you know, rather than the actual people who were involved. But that's a topic for another episode. But the point being that when we see something like an explosion, like you said, right? When it comes to, or like you had mentioned, police, we pay taxes and we get police coverage, firefighters and all that. When we see something as Americans, right in our face, an explosion, a violent act, we get together, we respond. You know, we lower the flag, we sing songs and praise America before basketball games, and we do show these big show of emotions on a kind of artificial level, I guess you could say. But when it comes to these big picture things that you have to do a little bit of research on, like COVID, for example, it's not a big alien with long arms that's coming and attacking people and running down the street. It's this little thing that's attacking us. And we just, you know, and healthcare in general, like you said, I mean, the ideal would be prevention, but instead we're more response oriented. And what you're saying is that we need to get more prevention oriented. Is that correct?
Totally. Because when you have a stealth, because it is literally a stealth disease like this, because it has such a big incubation period, also there are super spreaders, etc., you cannot fight it on the field of the hospital, because you are getting overwhelmed, you are seeing it.
Right.
It is simply too much. You cannot prepare an hospital for taking 1,000 patients a day.
Right.
It is not thinkable. No one can prepare. You literally don't have enough hands to take care of them. Literally speaking, enough bodies of the medical staff to take care of them. So you need to prevent it. You need to break the cycle. You need to break the cycle in some way, because otherwise, guys, you will run out of body bags. This is it.
Yeah.
Totally.
And it's interesting too. You know, I like the point that you just made, because, you know, it makes me think of like the Boston bombing for a couple of years back at the Boston Marathon. If you're familiar with that, and cases like that where, and that was a terrible tragedy, horrible what happened. But you have the Red Cross showing up, emergency healthcare workers are showing up, people, and like you said, it's we're not prepared to respond to something like that every day. Something like a 9/11 level event is happening almost every day here in America. We're over 1,000 people, and if you mentioned 2,000 in the buildings, but on that day 3,000 people total were killed when you count the airplanes in the Pentagon and all that. So you're talking basically like, you know, if we're going to give a conservative estimate here, we're a third of a 9/11 every day, because like you said, we're probably underreporting it, but just to be conservative estimate, let's say we're a 1/3. So every 3 days we're experiencing a 9/11 here in my country. And I'm old enough to, you know, I was a junior in high school when 9/11 happened. I mean, I remember what the response was like from an emotional, from a symbolic standpoint. And we're hitting that every 3 days in this country, and
that's crazy.
And the fact that we're being so flippant about it is just baffling to me. So it's definitely.
I think one of the worst thing that your but one of the worst thing that you did as society in the US was politicizing a virus. A virus doesn't make political differences.
Right.
A virus just wants to spread, you know.
Yeah.
So it doesn't care if you are conservative, if you are democratic, if you are democratic, they're called. If you're a Democrat, it doesn't care nothing about this. It simply and only cares about spreading and infecting. And this is the end of the bottom line. The virus is a virus. It doesn't care about what cell is infecting. It simply cares to infect.
Yeah, Dr. Fauci, he's the head of the CDC here, is being undermined by our president, who is calling him basically a whack job and undermining the message that he's giving to our citizens, which is, to me, is treasonous. I mean, I think that he should be, I think he should be removed from office just for that. But I'm my views on Donald Trump are pretty are pretty. I think I'm pretty open about that. So I won't get into that too much. But I just, to your point about it not being political, he called it. We have a president who called it a Democratic hoax from the very beginning. That is just so irresponsible as a leader of the nation. And
it is not irresponsible. It's simply stupid. Because when you have a big following, you can be an influencer, you can be a politician, you can be a doctor, you can be a YouTuber, whatever it is. Right. If you have a big following, you have a big responsibility. For the fuck's sake, Spider-Man told you, with great powers came great responsibility. Yes. Guys, you created Spider-Man. Come on.
Absolutely.
For the love of God. You know this.
Yeah.
So when you have such a big following and you don't understand that your words matter, because right. For the law of big numbers, there are a lot of brain-dead, stupid people, but still people that will hear your word and do as you say, whatever things you say.
Right.
Simply, what you do matters, what you say matters, because you influence what they do, and what they do, it will influence the ongoing of the disease, and this will influence people outside of their circle. Because they could infect a friend, they could infect a brother, they could infect someone that thinks totally differently than them, that has no fault.
Yeah, but people like you, unfortunately, are a minority in my country, where we take the word of the people that we look up to, and whatever they say, that's the truth, and we don't really question it beyond that. And I mean, even you had mentioned before our conversation today that you were going to provide me with some links to some of your research that I could put in the description below, because as I said before, I am a very big believer in seeking out the truth, educating myself. And I'm not interested in trying to share some kind of personal biases or opinions on the matter. I'm trying to get down to the facts. And I think, we need more Americans to do that. And I can only do my part. I don't have as big of an audience as the president, obviously, but I'm
not yet
trying to do, hopefully. Yeah. I mean, trying to do my part. I feel like what's happened with COVID, and, we were talking offline a little bit about the George Floyd situation, which I've also been talking about that a little bit. Those two particular things are really pivotal moments here in my country, and it's kind of drawing a line in the sand in terms of how you choose to perceive the world around you, and are you going to just accept the bad behavior of your leaders, or are you going to fight back and educate yourself?
It is not, it is not. There is a big degree of ignorance in society, in every society, not only in America. Don't worry, it is not only an American problem. Also in Italy, we have our conspiracy theories, we have our funny people, Right. But the point is that everyone needs to understand one simple thing. Today, the science, I take care of medicine because it is my field of study, but all the science is all evidence-based. There is a thing called principle of authority. The principle of authority is, for example, a Nobel Prize said this, or this person said this. In science today, the principle of authority is dead, because no matter who says what, it matters the data, what it proves. Because when you say something, and when you talk to the scientific community and to the people in science, you need to show them proof. Because if I say, for example, Christopher, you are stupid, I need to show the proof why you're stupid. Because otherwise, my assertion doesn't have any weight.
Right.
You need to do a study, you need to put up a theory, etc., etc., etc. So every single thing that we do today is evidence-based. This means that it is perfect? Of course no. People make mistakes. we make mistake. We maybe don't understand something that in maybe 10 years it will be obvious. It will be,
Right.
oh my God, how it is possible that 10 years ago the people didn't do this? You know what has been the biggest one of the biggest revolution in medicine? Has been one of the biggest life-changing, life-saving revolution in medicine has been washing your hands before a surgical operation.
Really?
Because, yes, because in the 1800s, the surgeons didn't wash their hands because they thought it was not necessary, etc., etc., etc. But when they showed them proof that by simply washing your hands before a surgical operation, you were literally increasing the success rate of the operation by 40%. If I remember correctly, if I remember correctly the number, it was around 40%. They said, oh my God, so it's true. This is how it works. But when they didn't wash their hands, it was not because they were stupid. They didn't know.
They didn't know, right?
Yeah, it is the same now. Maybe in 10 years, 20 years time, it will be something different, something groundbreaking, no problem. But as today, as we know, and what we do, it is all evidence-based.
Right.
Also, I want to touch very, very briefly on one thing, vaccine.
Sure.
A lot of people are scared of vaccines.
Right.
Guys, you need to understand one thing. Vaccines are the most natural response that there is to a disease. What we do as medical professionals and as healthcare providers is giving your own body his own weapons to fight a disease. I will make a comparison just to be simple. It is like taking a tank, putting out the barrel so it doesn't have any way to shoot you and to harm you, and tell to your gunners, okay, shoot that tank until it's dead. So they will practice, they will understand how to shoot, what to shoot, where to shoot, what to shoot, because this is the key point in medicine, using the right antibodies, etc., etc., etc. So your body needs to learn how to do and how to react.
I see.
And so when the disease comes to your body activates immediately the secondary response, because you have two kinds of responses into the human body: the primary response and the secondary response. The primary response is that response that is triggered when you meet an antigen, a pathogen, for the first time. So your body needs to understand what to do. And this takes time. This takes time. And in that time, you could die. Because, for example, if you get tetanus, from the time that your body understands what to do, you're dead. So it is no longer useful. But if you have trained your body with the vaccine for tetanus, your body already knows how to kill, what to kill, the pathogen, and so you will not get anything. So you will be fine. Remember that what they inject you, it is not something strange. It is literally there are active vaccine and deactivated vaccine. I don't want to go too technical, but the point is that what they inject you is exactly what happens in the body, but without any harm.
I see.
It is a weapon. It is a weaponless pathogen.
I see.
If it is an active vaccine, or they inject you pieces of a dead pathogen. Literally, we cut it. It is cut in pieces, and so your body understands how to break it down, etc., etc. This is the principle of vaccination. It is nothing so hard to understand when you see it. Because it is literally using your own body defenses to prepare him to fight a disease.
Right. So you're kind of just training it in a way, right? Like
totally.
to do what it's already meant to do.
Exactly. Right. And this is a big problem, because when you train something, when you train, I don't know, you said to me that you were a guard reservist.
Yeah.
If you don't shoot for 20 years, maybe you forget how to shoot, right? You don't shoot anymore so well. This is the same for the body. When you do a vaccination to a patient, there is a time in which it's covered. Maybe it's covered for a lifetime, or maybe it's covered for 1 year, or for maybe 6 months, 3 months. We don't know it. It depends from the different vaccine. It depends from the pathogen. It depends from the ability to the body to remember that pathogen.
Right.
For COVID, the real danger of vaccination of COVID is that we don't know how long they last.
Right. That's the
This is the
unknown.
big problem with vaccination for COVID, because maybe they will be available if you are lucky in a few months' time, maybe next year if you're lucky. From the medical standpoint, getting a vaccine in less than 4 years is incredible, because usually vaccination take sometimes decades to develop. So
Oh, wow.
making a vaccine in 3 years, it is groundbreaking. And so the real problem is how long the body will remember how to fight this virus. That's what scares us.
Yeah.
This
Yeah.
is the real problem, and no one can give you an answer because there is no vaccine available, so we have no
Right.
data.
Right. Yeah. And the one thing that keeps coming up when we talk about this is that unknown factor. And the thing is that's frustrating to me is the people that fight the validity of this virus. They keep pointing to that. They point to the perceived inconsistencies. Well, this person tested positive and didn't show any symptoms for 3 weeks, so that's so inconsistent. That's part of the thing. Is this is an unknown. There's a that we don't know what's going to happen in the future. And also I wanted to point to science in general, like as you had mentioned, evidence-based. One of the things that I understand about the science community and scientific research is that it does change and evolve as new information comes in. So theories and people use that to, and again, not to get off on another topic, but like with evolution, for example, things have come up in the study of evolution that in some cases might disprove something that Darwin said a long time ago, but it doesn't mean that evolution is not true. It means that our understanding of it is evolving, right? To use the word evolving.
Totally. This is the key point of science: evolving, changing, modifying itself, and sometimes even contradicting itself and saying,
Right.
what I said before, it was totally right.
Right.
This was totally wrong. Sorry. This is the key point of science. To be open about it and to understand it. But you need knowledge to do so. You need to study hard, because you need first to understand what was wrong before, and then maybe you can change it if you think it's wrong. But the point is that there are inconsistency in the patients. It's true. Some patients maybe they seems like they have recovered from COVID, and maybe a few weeks after they became infected again. This is the key point of what I was talking about, because you have one thing called IgG level. IgG level is the antibodies level. Antibodies are what our body uses to fight against pathogens. It is used as an indication factor. If you see, it is like having ammo. It is like seeing ammo. If I see that a lot of I don't know FMJs, I know that I need to kill something big and hard. Okay, it is the same here. If we see a lot of IgG level, it means that this person, a higher IgG level, it means that this person has already had this disease. And maybe you see an high IgG level and a low IgM level, which is the antibodies that it is produced for the first time that you fight a disease. And you can say, okay, maybe this person has recovered, or this and that. You do the different Tampax, the different tests, the oral test with the swab. And you check, when you do that, you check for the DNA, because you see if there is some DNA of COVID on the cells that you're taken with the little stick. And if there is DNA, you say, okay, this person has COVID. If there is no DNA, you say, okay, this person doesn't have COVID. And maybe you result negative to all of this. And then a few times afterwards, you result positive. Why this happens? We don't know. We don't know. This is the true answer. We are still studying it. We are still understanding it. For people that are worried about this, they say, oh my God, science doesn't know. Yes, guys, surprise, surprise, there is unknown in the world. We study it. We try to work to understand it. The knowledge that today we have, it is done thanks to our pioneer. 100 years, when Fleming discovered the first what's called in English, antibiotics. When he discovered the first antibiotics, he discovered it by chance, totally by chance. He was studying something else. During his study, something happened. And he saw, oh my God, with this substance, the bacteria dies. Oh my God, I discovered something incredible.
Wow.
This is how science works. Something you study something and you discover something else totally.
Bob Ross would call that a happy accident. I don't know.
Yes, totally. It has been totally an happy accident.
Yeah.
And so it is the same here. There is still a lot of unknown. And for this reason, we need to do the few things that we know that works. So socially distance and wear a mask. Because if you don't get infected, all the possible unknown are reduced to zero because you don't have the virus.
Right. Yeah, well, I really appreciate you coming on here today and helping to educate me and hopefully some people that will be watching this. I'm gonna have to cut it a little bit short here because normally we would be having this interview. I usually do my interviews in the evening, but you're 9 hours ahead of me over across the Atlantic Ocean. So my kids are only gonna have tolerance for this for so long. So I don't want to be a completely negligent father or anything. So, but we will definitely, hopefully connect again. I know you've got
no problem.
A lot of expertise and we were talking about some other things on other topics. And I think that you bring some good insight into those. So
thank you for having me.
Yeah, no, I really appreciate it. Thank you for checking me out once again. I will be talking with you again very soon. And remember, don't be afraid to question the consensus.